Excited to have a chance to talk with you today about collaborating with community experts to design approaches for federal earned income tax credit uptake in North Carolina. Our speakers today are myself, I'm Sarah Verbies, and I direct the Jordan Institute for Families at the University of North Carolina Chapel Hill School of Social Work. And today I'm joined by Alexandria Coffey, who is a doctoral research assistant and is also part of the Jordan Institute for Families, and with Philip Sheldon, who is a partnership manager at Roll Forward, a program of MDC. The three of us are representing a larger team with faculty and staff from the UNC School of Government, the NC Impact Project, MDC, Together Transforming Lives, and others here at the UNC School of Social Work. So for today, we have a lot we want to cover in our time with you. We are going to offer you an introduction to what the Earned Income Tax Credit is and talk to you about who is eligible and how much money they may be able to receive. And we're going to make a clear connection to maternal and child health. We're going to briefly talk about our project, our findings, and offer you some key takeaways and tips for sharing information about EITC with the people that you serve. Finally, we're going to conclude with some resources. So I'm going to turn it over to Alexandra.
Good morning, everyone. So the Earned Income Tax Credit, I wanted to provide an introduction to kind of what that is. Some quick, fast facts. It is one of the largest anti-poverty programs in the United States with the goals of promoting work and reducing poverty. And in 2018, the Earned Income Tax Credit lifted 5.6 million people, including 3 million children, out of poverty. And about 1 in 5 eligible workers do not claim the Earned Income Tax Credit, and that inspired our project that we'll discuss later in today's presentation. Some key characteristics of the Earned Income Tax Credit. One is that it is a refundable tax credit, which means that it provides people cash in hand after they have paid their owed taxes. For example, an EITC eligible person with 3 children that might determine that they owe $100 in federal income taxes. They are married and have an annual household income of $50,000. And so their earned income tax credit benefit amount would be $6,628 after subtracting the $100 in federal taxes that they owe. One important distinction we wanted to make is that the federal earned income tax credit is separate from state earned income tax credits, as well as the child tax credit, the child and dependent care tax credit, and stimulus payments. However, all of these programs are important and critical for MCH populations. There are also many eligibility criteria for the Earned Income Tax Credit. However, the 3 listed on this slide are most commonly used to identify folks who are most likely to be eligible. And those include earned income, having a Social Security number, and being between the ages of 25 and 65 years old, or having a qualifying child. On the right-hand side of the slide is a graph that demonstrates the maximum credit amount by the number of children and filing status, either married or single. Those filing with children are eligible for significantly greater amounts of the credit compared to those filing without children. And additionally, those who file under married status have a wider income range in which they can earn the maximum credit amount compared to those who file under single status. For 2021, the American Rescue Plan sought to address some of these equity gaps in the credit by including families with children in the home, without children in the home, and people aged 19 to 24 and older than 65 years old. This includes populations that could be caring for children, including grandparents, however, may not be able to claim these children on their taxes for a variety of reasons. Additionally, the maximum credit amount increased and the income range where the credit phased out was increased, resulting in more households being eligible for the credit. And now we want to mention how this tax credit relates to MCH populations specifically. So there's actually been quite a bit of research conducted on the impact of the EITC on MCH outcomes. One, it improves health by lifting households out of poverty. For example, it can increase income by 40% for a minimum wage worker with 2 children. It has been found to reduce low birth weight rates, preterm birth, infant mortality, and abuse and neglect. Additionally, the earned income tax credit has been shown to improve maternal, mental, and physical health, as well as reduce smoking. And lastly, families of color experience significant health inequities and face added barriers to financial advancement due to systems of oppression. So as such, the earned income tax credit is a particular important financial tool for families of color. And now I'd like to transition to my colleague, Philip Sheldon, to discuss more about our project.
Good morning. So I'll just talk briefly about our project objectives and our project aims. So our objectives throughout this research project were the following. So develop a comprehensive understanding of federal EITC uptake in North Carolina. That is, we're researching what are the primary drivers and barriers that people experience when trying to claim the federal earned income tax credit in rural North Carolina. Another one of our objectives was focused primarily on identifying strategies that rural communities can use to increase uptake of federal EITC and potentially other income supports. And so you can see where we did a lot of this research in the counties that are highlighted on the map on the right. So from the west, you get McDowell County, which is based in the mountains. County seat is Marion, near Asheville, if you know where that is. Rockingham County, primarily Reedsville. Then we have, if we're going down to the southeast, Robeson County, which has a large population of indigenous population with the Lumbee tribe in Robeson County. And then we have sort of a regional area around Nash, Edgecombe, and Halifax County, which is all sort of centered around the two cities of Rocky Mount and Roanoke Rapids. And then Beaufort County out in the east, which is centered around Washington, North Carolina. And so these counties represent a variety of different experiences across the state. They're all rural in some way. And so, as you'll see at the bottom, all of this work and all aspects of this project were done with a community-based participatory research framework. And so as an example of how that looks on the ground, the protocols that we used in focus groups that we held in those counties that you see on the right side of the screen were developed in collaboration with the local research groups. And then those local research groups themselves were pulled from members of the statewide steering committee who informed us of local leaders who would make great candidates to participate and help us in this research work and work with us in this research. Next slide. So some of the key findings that we pulled from some statewide data analysis on tax returns and then also from the focus groups. So I'll start with some of the findings from the statewide data. We found that one of the main predictors of federal EITC uptake was race, that as county percentage of the county population that was Black, Hispanic, or Native American increased, then the earned income tax credit uptake in that county would also increase. We also found that information and messaging was really important for people on how they got information on the earned income tax credit. This information in particular, it needs to be shared in October and November. Messaging is also really important. Some people reported that there was nothing free that came from the government, and maybe some misunderstandings about what exactly the earned income tax credit was. So framing it as sort of, this is your money that you're receiving back from the government. And then also, this research was being done and these focus groups were being done during the COVID-19 pandemic. And so there was some confusion around current stimulus and other COVID-19 related benefits, if this was the earned income tax credit or if this was a stimulus payment that folks received. Another thing that we found was that tax preparation and who you go to get your taxes done does matter. So there's a variety of different services used. There are the for-profit tax preparers like the H&R Blocks, but there are also a lot of folks who use friends and families for their tax preparation services. But another thing that we found was that taxes in general make people nervous and they're afraid of messing up on their taxes. They're afraid of getting something wrong, having to make an amendment. And so people often go to other folks to get their taxes done. And then determining who gets to claim a child is not always abundantly obvious, and so that can lead to some confusion in the tax preparation process. I'm going to turn to trust. So there were concerns about scams. Like folks were saying before, it feels a little too good to be true, is what we heard from some of the focus groups, that the government would just give me money. Of course, it's a little bit more complicated than that. But people who are not citizens also had some concerns about the Public Charge Act, that information that they file on their taxes could be used against them and potentially lead to deportation. Or other adverse consequences. And then some trust the person filing their taxes enough to not ask questions. And many people also do not trust the government. And so people feel sort of isolated, but when they work with someone that they trust, they sort of pass off that process and say, okay, I trust you to do these taxes. And in some cases, they may be missing out on the earned income tax credit. And then communication. So conversations around taxes only really occur during tax season, and folks want to hear from trusted community leaders. And when you are communicating about the earned income tax credit or taxes in general, there's a need to make sure that this is done in a multilingual fashion, that these are detailed, and that they're also framed appropriately. I'm going to pass it over to Sarah again to take us away with the key takeaways.
Thanks, Philip. So here's some key takeaways for you to consider. And I think our meta suggestion to you is that earned income tax credit and other financial benefits are important for maternal and child health professionals to know about and to share with the people that you serve. So one way you can start is to identify ways to share information about the earned income tax credit in your networks. So this can be home visiting, WIC, people that are offering care coordination, child care centers, pediatricians, and other social services such as TANF and SNAP. So wherever you can find families with children is a really important place to start. You can also partner with organizations in your state actively working on taxes and budget. So for example, in North Carolina, we have the Budget and Tax Center, and they have a wealth of knowledge, information, and connections so that you don't really have to do this on your own, but really look to the power of partnerships. And finally, pay attention to these programs, as I said at the beginning. Getting financial resources to families really can help us achieve our collective goals for these families. Next slide. And so last slide, so tips for sharing earned income tax credit information. So as Philip mentioned, begin sharing this information in October and November. There are families that really want to speed up the process, that they might have resources for the end of the year holidays. So it's really important to pay attention to getting this information out, not just in February. It's also important that the information has enough detail to help people know if they qualify and how much they might get. This is definitely an incentive for them to continue for the rest of the work to make sure that that happens for them. Encourage folks to file taxes, even if they're not sure for the EITC. There may well be many benefits that are due to them that they aren't able to receive because they aren't filing taxes. It's important to encourage people to ask their tax preparers about earned income tax credit, especially if that's a family member or a friend. Support them in asking that question. It may be hard for some people to ask that question, particularly if it's someone in their family who may be in a position of authority. But it's really important for them to make sure that the person who's preparing their taxes has considered this information. Language matters, so it's really important to emphasize ownership. These are funds that they earned and that belong to them. And finally, it's really important to make sure that information is available in many different languages. And when we're working particularly with mixed status households, the messenger who is providing this information needs to be someone who's trusted. So next slide. Hopefully we have gotten you interested in earned income tax credit. So we wanted to offer you a few resources for you to explore. We have resources listed at the Jordan Institute for Families website. At the beginning of our project, we put together an EITC basics video that you can watch and freely share. There is a link to the most current information on EITC available through the government, and also a link for a qualification assistance. So we appreciate your time. If you have questions or would like more information, you can contact me. Again, want to thank Alexandra and Philip, and really lift up our whole team, Calvin, Danny, Anita, Whitney, Paul, Catherine, and so many others who've made this work possible. Thank you so much.